welcome to another episode of
Sportsmed TV.
I should say today is a rather great morning because a Filipino gymnast just won gold at the recent 2019 World Artistics Gymnastics Championship.
Yes, that is exciting news for everyone. Carlos Yulo is the very first Filipino world champion in gymnastics.
Well, this is going to be a very interesting episode because today is going to be all about gymnastics. So of course, we have our trusted Doc Asenas here who will give us medical insights on the common injuries of the sport.
So let's not waste time and start with a common injury you might be familiar with, the ATR or the Achilles tendon rupture.
So David Beckham and Kobe Bryant are the two most famous athletes who have suffered from this injury. Unfortunately, this injury is common in gymnastics too. So an Achilles tendon rupture is a complete or partial tear that occurs when the tendon is stretched beyond its capacity. Forceful jumping or pivoting or sudden accelerations of running can overstretch the tendon and cause a tear. An injury to the tendon can also result from falling or tripping. So Doc, can you tell us more about this?
So here's an example of a lateral x-ray of an Achilles tendon rupture.
In the images presented, the lateral X-ray of the ankle demonstrates attenuation of Kager's fat pad with poor definition of posterior border which correlates to the Achilles tendon. In these images, there is also poor definition of the fat stripe around the attenuation that is typically seen in the region of the Achilles tendon. This is really an obvious sign of Achilles tendon pathology. Here, an MRI clearly demonstrates an Achilles tendon tear.
That has to be extremely painful. So let's move on to another common injury in gymnastics, the anterior cruciate ligament tear. So basically, this ligament is the primary stabilizing structure of the knee. It is also the primary strain to anterior translation of tibia and as well as the tibial internal rotation.
There are many maneuvers that we can use in order for us to detect ACL tear, and it is the Lachman test that is the most accurate. However, for those patients who are suspected with ACL injury, the initial imaging study to order should be X-ray in order for us to rule out fracture. Always put in your mind that it is the magnetic resonance imaging is a primary study in order to definitely diagnose ACL injury. It can also identify concomitant meniscal injury, collateral ligament tear, and bone contusions.
So as we all know, this is a very extremely difficult sport. So in gymnastics, athletes not only land on their feet, but also on their hands. So let's take a closer look into Cole's fracture, which is a fracture on the distal radius. So again, Doc Asenas is here to give us more knowledge on this injury.
For Cole's fracture, the plate radiographic series often comprises an anterior posterior view, a lateral view, and an oblique view. The fracture appears extra-articular and usually proximal to the radioulnar joint. And there is also an obvious angulation of distal fragment which result in the shortening of the radius. And in up to 50% of the cases, there is an associated ulnar styloid fracture.
And now for our last injury for today's episode, let's get to know another risk injury, the scaphoid fracture. So scaphoid fractures usually occur in young adults after a fall on an outstretched arm resulting in an acute dorsiflexion of the wrist. Is it right, Doc? Okay, so the patient typically presents pain on the radial side of the wrist, tenderness on the snuff box, and pain on palpation of the scaphoid tubercle. And difficulties, of course, with range of motion. So radiographs are necessary to confirm the diagnosis, and sometimes an MRI or magnetic resonance imaging must be performed.
So of course, we have Doc here to show us what is usually seen on our radiographs.
These injuries typically seen on X-ray as a widened and irregular distal radius disease. All the wrist pain in gymnasts has been considered a normal and direct consequence of this sport. The complaint of pain in younger patients should be carefully evaluated. Scaphoid fracture is a serious injury because it disrupts the blood supply over the proximal pole of the scaphoid, which eventually leads to a vascular necrosis. A vascular necrosis is diagnosed by noting increased intensity on the proximal pole of the scaphoid compared to the remainder of the carpal bones. When this occurs, the treatment should be surgical intervention with metallic screw and bone grafting to obtain healing.
So as I've said, gymnastics is a difficult sport, so please do not try this at home. Gymnastics takes long hours of practice. Pushing through the pain through each fall takes so much dedication and passion for the sport.
Couldn't agree more. And sadly, this is all the time we have left for today. And thank you, Dr. Asenas, for sharing us with your knowledge about these injuries. And this has been a very interesting episode.
So this has been Leah
and Burge Mark your calendars because next week we will see you again, same time.
Just here on
Sportsmed TV.